Hello and welcome to another MRC presentation. The topic of today's presentation is a mini introduction to myofunctional orthodontics. Myofunctional Research Company, or MRC, was established over 30 years ago and creates simple, innovative appliance systems which consider the relationship of the airway and mouth breathing to malocclusion, TMJ, and sleep disorders. My name is Dr. Emad Ahangari and I'm the Clinical Development Officer at MRC. Myofunctional orthodontics is a field of treatment which is different to early or phase 1 orthodontic treatment, as the treatment goals are vastly different. Allow me to present this case which illustrates this point. This 9-year-old female was treated at the age of 8 with phase 1 orthodontics and was subsequently placed into retention. You'll notice that the patient rests with her tongue resting down from the roof of her mouth and between her front teeth. The patient's teeth are nicely aligned, but the open bite has begun relapsing despite retention just 7 months after treatment completion, because her oral muscle function was ignored. Let's take a look.
And show us how you swallow your spit now. Okay, so you can see all this muscle activity around the chin. And then just open again for me. I'm going to pull her cheeks away, bite your teeth again, and try and swallow. All that head movement and the tongue thrust. So this is why it's very important to control the muscles, especially when you're doing early treatment. Even while I'm pulling the lips away, this lower lip is contracting because she's trying to make contact between the tongue and the lip to swallow.
The point here is that phase 1 orthodontics focuses on the teeth and doesn't address function, while myofunctional orthodontics assesses and treats the teeth as well as the patient's function. Let's contrast the previous case with this one, which was treated at MRC's clinics. This 8-year-old female patient, the same age as the previous case, attended our clinics with the complaint of an open bite. Upon further assessment, we identified a narrow upper jaw and a slight overjet, while also having breathing and myofunctional issues. Using the MyoBrace treatment system, we treated the patient's breathing, myofunctional habits, while also developing the arch form and aligning the teeth. We can see the open bite closing nicely, but most importantly, 1 year on, the open bite has not only stayed stable, the teeth have even settled further. We can see the improvement in the arch form, which has resulted from development of the arches, and also improved tongue positioning, which helps to maintain the arch form and brings the tongue upwards and forwards out of the airway. This is why the upper arch is in the shape of the tongue. This is how the patient looked when they were finished, and despite a pretty good orthodontic result, the priority here was the correction of her muscle function and breathing. And we can see the patient continues to develop nicely as her function has been corrected. And these were her results 1 year after treatment was completed. The key here isn't that we straighten the teeth, because after all, the first patient that I showed had that done as well. The key here is how do we get the teeth straight by correcting the patient's function. Because the vast majority of children develop orthodontic issues, it's even more important to create a simple approach that can be implemented by any dental practitioner while making sure that it's easy for the patients too, for maximum effectiveness. The MyoBrace system consists of the MyoBrace appliances.
How does your MyoBrace work? The MyoBrace appliances work by teaching your tongue to rest in the correct tongue resting position. Breathe through your nose normally and swallow the right way.
These are prefabricated appliances used for 1 hour while awake and overnight during sleep, which promote the correct breathing and myofunctional habits in children, while also helping to develop the arches and further improve function. On top of the MyoBrace appliances, we also use the MyoBrace activities.
MyoBrace activities help this by stretching, strengthening, and retraining your tongue, lip, and cheek muscles, as well as improving the way you breathe.
So these are a series of animated, child-friendly collection of exercises which are delivered in a particular sequence to improve breathing function, as well as a stretch, strength, and tone of the orofacial muscles. And there's plenty of evidence now that backs up that myofunctional correction is achieved with these appliances. I've taken these quotes directly out of this systematic review. We don't have time to go over them all today, but all these papers go on to show that the MyoBrace system does in fact create myofunctional correction. But what many people didn't know is that Dr. Edward Angle, the father of modern orthodontics, also believed these principles. This quote was taken from his 1907 publication, in which he stated that of all the various causes of malocclusion, mouth breathing is the most potent, constant, and varied in its results. Angle believed that the change from nose breathing to mouth breathing triggered a change in the muscle patterns of the patient, which pushed and pulled the teeth in various directions, causing crowding. Even Dr. Bill Prophet, one of the most influential orthodontists of the modern era, corroborated these ideas by stating that the major primary factors in the dental equilibrium, or in other words, where the teeth sit in the jaws, appear to be the resting pressures of the tongue and lips. Respiratory needs, or the need to breathe, influences head, jaw, and tongue posture and thereby alter the equilibrium. This idea also makes sense because the teeth don't know if it's braces or muscles pushing on them. Given enough time, the teeth will move regardless. Even in the past few years, the American Journal of Orthodontics has been publishing papers which also verify these ideas. That mouth breathing and the lowering of the tongue can have a profound influence on facial development by the time the patient comes in for orthodontics. We can see these ideas persisting for many decades to the point that even the AJODO sees the need to evaluate beyond the teeth, which is exactly what myofunctional orthodontics is. So how does the problem develop? Mouth breathing leads to the mouth opening, which causes the tongue to drop from the roof of the mouth and a poor swallowing pattern to develop, which alters the patient's development and crowds the teeth. So if we were to treat this issue properly, we should start from the beginning. We should treat the breathing, then the habits, then develop the patient's arch form, and finally we should align the teeth. Unlike the way things are currently done, which just focuses on the end bit here, myofunctional orthodontics likes to look at the problem from its foundations. So, in summary, this is what myofunctional orthodontics is. The goals of myofunctional orthodontics are different to the way things are done currently. We want to establish nasal breathing, correct tongue position, correct the swallow, and correct the lip posture. We want to encourage a correct diet, as we know that a poor diet can interfere with the patient's breathing patterns. And finally, we do want straight teeth. It's not that we don't want straight teeth, we just want to do all the rest of these things too. And we do this by using the myobrace appliances and the myobrace activities as mentioned earlier. Nice and simple. The appliances achieve their goals through purpose-built features within them. We don't have time to go over all of them today, and you can get more information from our website. But the most important thing is that they're all worn for 1 hour a day plus overnight. This is far less than any other orthodontic appliance and technique, as we are not focusing on the teeth, but the breathing and myofunctional habits. Then we allow the muscles to do the rest of the work for us. There are plenty of myobrace appliances, but the most commonly used is the K series, which is used in the mixed dentition. These kids are young enough to be growing rapidly, which means we can get good results, but also old enough to comply with the treatment. The sequence is simple. We use the K1 to establish nasal breathing and correct habits, then the K2 to develop the arches and further correct habits, then the K3 to maintain the correct habits and finalize the dental alignment. If that's confusing at first, just remember the appliance sequence relates to the order in which the problem arises. So K1 for breathing and myofunctional habit correction, K2 for arch development and further habit correction, and K3 for alignment and retention. Nice and simple. Again, you can get more information on this from our website, myoresearch.com. Let's now show you a case which highlights some of the things myobrace can do. This patient was just under 7 years of age when she came to see us. We can see some significant orthodontic problems like an overjet, deep bite, and narrow arch form. She also had a completely blocked out lower right lateral incisor and blocked out upper lateral incisors. Some significant orthodontic issues were present. As we suspected, her sleep questionnaire also showed many signs of breathing problems, as most of these were ticked yes. Although she is before orthodontic age, this is a case where we would typically start treatment using the myobrace system. And you can see here how nicely the myobrace system has corrected this girl's orthodontic issues, with her deep bite and overjet resolved and a large amount of space created for the erupting teeth. The arch form has not only been corrected at the end of treatment, it continued to improve after treatment as the patient maintained correct function during the retention period. All of her lateral incisors are now fitting in comfortably due to the corrected development which has occurred. This is how she finished. This is how her facial profile development progressed. And finally, this is how she was at her most recent retention visit. Not only having her dental status maintained after a significant amount of correction, but the dental status had also improved after treatment completion. But what I like the most is that her breathing questionnaire now shows that most of her breathing symptoms are improved, and her mother writes that she chooses to sleep with her myobrace in, as she says it helps her get to sleep quicker. So this brings to an end our mini introduction to myofunctional orthodontics. There is plenty more information that can be learned, and you can do so now anywhere, anytime by visiting our website www.myoresearch.com. There are a range of online courses available for practitioners to complete if they want to know more about the appliance systems, and there is also the appliance pages, which have plenty more information about our appliances. Thank you for listening to this presentation, and we hope to see you on our website very soon.